Okay, so now it's 3:02. Okay, I think we should start. Okay, we have now 99 people on board. Yeah, which is quite a good number. Yeah? 100 now. It has reached 101. Yeah, so just like the stock market. Sorry. So just you know, maybe some dry joke. Yeah, to make you awake. Okay. I can still hear Laila. Okay, you off your mic. Can you mute your mic, Laila? Yeah, thank you. Okay, so we have now 102 participants online. Okay, so we hope more will come in shortly. Yeah. Okay, so Sarah, can we start?
Hello, good afternoon.
Yeah, Sarah, can we start? Do you think we can start?
Sorry.
Right?
Can you hear me?
Yeah, I can hear you.
Great. Okay.
Yeah.
Good afternoon. Yeah. Do you want me to go ahead?
So, let me do the flow. I'll get my dean to make his welcoming remark first, then I'll invite you. Yeah. So I just want to make sure that everybody is ready. Yeah.
I'm ready.
Okay. Thank you.
Thank you.
Yeah. So that's the thing about webinar, because sometimes we don't see each other. Okay. Okay. So. Okay, let me just share. Okay, first of all, okay, we will start our webinar now, yeah, with the welcoming remarks from Dr. Abdul Razak Abdul Manaf, Dean of the School of Applied Psychology, Social Work and Policy. Unfortunately, he is not here, okay, online with us, yeah, because he has some other commitments, but he has kind enough to record, yeah, to pre-record his welcoming remarks. So I'll play for you, yeah, his video, okay, as his welcoming. Yeah. Okay.
Assalamualaikum and salam sejahtera. Good day and hello to everyone. My name is Abdul Razak Abdul Manaf, and as a Dean of School of Applied Psychology, Social Work and Policy, Universiti Malaysia, it's my pleasure to welcome all participants. We are delighted to have you all with us today, participate and engage in this webinar session, organized by SAPSP UUM, Malaysian Association of Social Workers MASW, and UNICEF Malaysia. This organized webinar is crucial in disseminating knowledge and sharing expertise to the general public, especially on working with children during recovery from trauma movement order. It is a good platform for us as social workers and other human services providers discuss various social work approaches and practices for the benefit of all. We are honored to have esteemed speakers, mentors, and moderator with us today. I do hope all participants will get useful insights and get inspired with this sharing experience and opportunity. Before I end, I would like to express my heartfelt gratitude to all parties involved for making this webinar a success. Have a great sharing discussion.
Okay. Sorry, I think there's some feedback from the floor that the sound was not clear. Is it? Can you hear the speech by Dr. Razak just now?
I think we could hear. The voice was a little bit distorted, but we could hear.
Okay, that's fine. Yeah, okay. But on behalf of SPSP, our dean would like to express his gratitude, yeah, for everybody to join the webinar. Yeah, unfortunately he's not physically not in the office today. Yeah, he has some other engagement, so he sent his apology, and that's why we have this video. Yeah, okay. So next, yeah, I would like to invite Miss Sarah. Yeah, Miss Sarah Northern Style, okay, Chief of Child Protection from UNICEF Malaysia, to give her welcoming remarks. Okay, the floor is yours, Sarah.
Great. Thank you very much, Teoh. Good afternoon, everyone, and particularly good afternoon to Dr. Abdul Razak, the Dean of UUM, Dr. Muhammad Suhaimi Mohammed, the President of MASW, Dr. Azlin, and Mrs. Amy Bala from MASW. and as well to all the MASW colleagues and social workers who are present and have joined, and to Francesca Stuer of Maestral, as well as other partners. I'm really excited to know that we have over 100 participants, and thanks to everyone. On behalf of UNICEF, I would like to express my sincere appreciation to MASW for organizing this important webinar, and to all of you for your commitment and interest in the issue of strengthening social welfare and supporting child protection in Malaysia. This event was organized with the purpose to disseminate the social welfare tips in the context of COVID, noting the increased protection threats that children are facing as a result of the global pandemic and the constraints facing social welfare service providers in being able to access and support children at this time. The social welfare tips were designed to better support social workers during the emergency and the MCO, noting that online support was the best way to reach out when other face-to-face training and information sharing was not possible. We know that globally, as well as in Malaysia, child protection programs that prevent exploitation and abuse of children have been negatively impacted by the pandemic, as child protection and social service workers have had more limited access to children and families and communities, and are thus less able to provide support to the children in need. Unfortunately, we're also aware that domestic violence and violence against children at home have increased during lockdowns, where families and parents are under increased stress. The stress of increased household poverty and decreased access to education are also contributing to poor mental health outcomes and child development outcomes. So the question I think we're asking ourselves today is, what can we do to address this? And in UNICEF, we say that one of the most important things we can do is to ensure that social welfare is recognized as an essential service, particularly in times of emergency or crisis. The social welfare workforce must be strengthened, including support for increased capacity and skills building. And that's why we're here looking at the social welfare tips, being innovative in our skills building. The COVID crisis has heightened the risk of children and diminished the ability of social services to better protect them. Dedicated and qualified social service workers support children and families by alleviating poverty, identifying and managing risks, and facilitating access to essential services for those in need. I also wanted to remind that the situation of children affected by migration is amongst the most concerning globally, as well as in Malaysia, and the importance that social service workers can provide to reach out to those vulnerable and marginalized children, including those who are migrants and those with disabilities. In UNICEF's Agenda for Action on COVID-19, we are calling for global coordination to prevent a health crisis from becoming a child rights crisis. So thanks to everyone for your support and cooperation in this important Agenda for Action, and we hope the social welfare tips are useful for everyone, and we appreciate your feedback. Thank you.
Thank you, Sarah, for the welcoming remarks. So we will now proceed with the presentation from Ms. Francesca Stuer. Okay, let me read out her credentials, which I'm sharing here. So Ms. Francesca is an associate, senior associate with, how should I read this, as Maestral International?
Yes,
Maestral International, So she has experience, internationally on social and health development, and also in particular strengthening social service workforce capacity, child protection, case management, and positive parenting. So she has done quite a lot of consultation and work, in many parts of the world, in Africa, in the Caribbean, and she has worked, with UNICEF, in many of the region, and also she has helped to develop the evidence-based Semarak Kasih positive parenting program for Malaysia. Okay, so we can read more about her credential here, which is quite impressive. So she is speaking to us from Belgium, from Antwerp, Belgium. So, without further delay, okay, I would like to welcome Francesca to start the presentation. She has already sent me the slides, so I'm going to run the slides now. Yeah.
Okay, thank you very much, Mr. Teoh. So hello everyone. I'm delighted to be here today. It's really fantastic. There's such great interest in this important subject. So,
okay,
sorry, okay.
Okay, sorry, yeah, I will continue the slide from here, yeah, okay.
I'll start. Yes, that's it. So how did this start, actually, this initiative to develop tips for social workers and other professionals that are directly interacting with children in vulnerable families and conducting functions or responsible for functions associated with social work? It's because we'd already been working a lot on strengthening social work and strengthening case management for vulnerable children. And then with the emergence of COVID-19 and the importance of containment, the importance of lockdown to reduce the spread of the virus, it became very difficult for social workers to continue with their case management functions. Also, so that was happening on one side. On the other hand, also we were seeing in many countries, because Maestral is also one of the leaders of the Changing the Way We Care initiative, which is about increasing or promoting and family-based alternative care for children without adequate parental care, and deinstitutionalization of children who might be in residential care institutions. So what we were seeing also in that context is that there was a huge increase in unprepared deinstitutionalization, children being sent home from residential care centers without adequate preparation, and then specifically also without adequate attention given to the risks of COVID-19 infection in that process. So we decided, look, it would be good to see what we can do to help social workers worldwide still continue case management functions, but in a safe way, in a virtual way as much as possible. So I will present the purpose of these tips, very quickly run over the case management steps that really informed the identification of the focus of what the tips would be about. Then we'll run through the tips and then quickly touch on next steps. Yes, next slide, please. So the purpose of these tips is to protect children from violence, including violence against children, prevention and response, and mental health care in the context of COVID-19. So this is guidance for ensuring case management, specifically when face-to-face engagement with the child and their family is constrained due to the risks of transmission. This is designed specifically for social workers and social welfare or mental health professionals. Yes, next slide, please. Yes, Mr. T, yeah, good. So to be able to consider what are all the functions that social workers fulfill when supporting children at risk of violence and mental health concerns, we specifically took into account the flow of case management. First, identification of children that might be at risk, then an assessment. How do you assess children when you cannot have a face-to-face visit or contact with the child and their family? Then developing a case plan, providing direct services or referrals. So what services can you provide and what is really of particular importance in the context of COVID-19? Monitoring their situation, and then what we didn't consider is case closure, because that's an easier step, more easily conducted virtually and on paper. Yes, go ahead, please. Next slide. So there are 10 sets of tips, and they are sets. It's not just one page. We tried to make this as practical and as user-friendly as possible. No long text, but really tips. What really can I do as a social worker to help these children when I cannot be in close contact with them? To identify is the first set of tips. The second one is to assess. The third one is how to provide psychosocial support. Fourth one is how to help the family and the child manage stress and mental health. The fifth one is very specifically about when there is a risk of violence. We have seen also, as Sarah has also shared, we have seen reports worldwide in every country of increased cases of domestic violence because people are locked up in home, very little space, and so tensions arise or tensions escalate, unfortunately. How to stay safe, how to help them plan to remain safe, how to conduct monitoring virtually, and then 3 sets of tips which are really very specific to children in residential care, how to keep children and staff safe within the care centers, how to reunify children from residential cares with their families in a safe way, and what are the issues we should pay attention to specifically with young people leaving residential care centers. Yes, next slide. So the first set of tips is about identifying children and families at risk. And then, so the recommendation is to seek, we are only highlighting what's in these tips. Of course, there's much more in the tips themselves. So you're encouraged to download them and look at them more in detail. So this is to seek agreement with those who usually identify children at risk at community level, including also first responders. In many countries, often the first responders are often police, emergency services, and are not always taken into consideration within the social work response to children at risk. But I have heard, I know that in Malaysia there is a close collaboration, so this is really great. Then to engage in regular communication with helplines, local helplines, community partners, to share updates on what is changing in the guidance regarding COVID-19 and actions to protect children and vulnerable adults. What are the standard procedures? Who should follow up? So that's really clear. Who do we contact? Who does what? And also how to note down the contact information of the child, of the family, so that they can be followed up, that this is done in a standard way. And then to agree and to identify very actively services, linkages, ways to collaborate, coordinate. In these tips also, it describes the various categories of children with heightened protection needs, and also provides guidance for timely and appropriate follow-up of each identified child and family. Yes, next slide, please. The second set of tips is around assessment. How do we gather information about the child and the family situation while limiting physical contact? So a lot can be done via phone, WhatsApp, or other online platforms. Also, what I have seen quite a few in locations, including here in Belgium, is sometimes the social worker might go to the house, stay outside, but ask the mother and the child to come to the door so that they, from a distance, actually see the child. Huh? So, what is the process? Is to assess first what is their physical, mental health, not only of the child but all household members. How are they spending their time during COVID-19 confinement, because this really does often bring about a lot of stress. And then to share tips around staying healthy and managing stress. There are other tips that are very specific about that to go into more detail. And then to provide the hotline number. And then also, it is unclear to me whether this exists in Malaysia, but in many countries it does, is that hotlines also sometimes have a code or have a word that can be mentioned in to indicate that there is danger. If the person is calling the hotline, to make sure that and then, for example, in some places they quickly send a Grab taxi. This is automatically part of the automatic response, immediate response, so that the person can run out of the house and go to a safe shelter, can be brought to a safe shelter. So this is done with a code word. So the social worker would then share what is that code word in the event that there might be danger. And then the tips also provide specific questions to assess the status of the child and the family. Yes, next slide, please. Around on how to provide psychosocial support. So virtual psychosocial support should be given to both the children and the caregivers. Really important. And a lot can be done through regular communication, through phone, social media, through Skype, through Zoom. In general, the recommendation to keep children close to their family and their parents, unless, of course, there is a concern about specific danger to the child, then another intervention must take place. But in general, it's not to splitting them, separating them, to talk about feelings and to talk about the children's concerns, to talk about feelings of the caregiver, and to encourage the caregiver to take care of the children and of themselves, not to forget themselves, to maintain familiar routines. Another really important issue is to advise and to help the caregiver, the child, if they're looking up information, to make sure that the information they are getting are facts and not rumors, because being locked up in house, we often look at internet really a lot, and that can be a factor of stress. So really it's important to look at the facts and then to recognize their strengths. And the tips provide specific messages for each of these topics, each of these areas of psychosocial support, what exactly to advise, what kind of questions also to ask. Yes, next slide, please. There's a set of tips also specifically around managing stress and mental health. Again, so much can be done through the phone or virtual contact to help them manage stress and mental health. These tips are specifically around showing empathy and understanding and planning how to seek help if it's needed, about establishing a routine, around connecting with others, around taking care of the body and of the mind, about moving the body, physical exercises, around relaxation, about positivity, remaining positive, about keeping the mind occupied with positive things, and again, limiting information intake. So you see in the tips number 3 and number 4, psychosocial support, managing stress and mental health, there are topics or areas that overlap because, of course, they are related to each other. So, and then there are specific messages for each of these topics around how to show empathy, establishing a routine, connecting with others, etc. Yes. The 5th set of tips is around staying safe when there is a risk of violence. So when you're worried about the safety of the child or of the adult or of both within the household, then it is really important to have a strategy to intervene. So we also, when we talk to survivors of domestic violence, we note that when we ask them what really helps you when you are in a situation of crisis, and what is really important is to have someone in their life who is there for them without judgment, whom they can bounce ideas off, get support, and lean on when things are tough. So then that's what makes it then really important as a social worker. And when we cannot really physically intervene, but we kind of come inside the household to see what's going on, is to remain in contact again through the phone, social media, etc. to regularly discuss with them. If there is immediate danger, indeed, Kamal also explaining how to use communicating. And then,
sorry to interrupt, Francesca. I'll try to get the somebody off your mic first. PCKKNB1. Sorry, yeah, sorry for the interruption. Okay.
So then the tips, this set of tips also provides specific guidance for how to communicate with the survivor of domestic violence. So it's about listening up, linking, planning, and staying connected. So there's a whole series of suggestions for what to say, how to ask the questions, what to pay attention to also as a social worker to be able to get other support. Also, these tips also provide guidance for how to communicate with the person at risk of abusing others. Of course, within a situation of lockdown, it's stress. There are many people are vulnerable, but it's both in terms of being a victim or being a survivor, but also being an abuser. It provides being locked down provides a huge amount of stress. How to communicate, what to do. Next.
Sorry, there's one participant. Can you off the mic? Yeah. Participant yang gunakan Acer under the name Acer. Sorry, Francesca. Sorry, let me hold the. Yeah, because okay, thank you.
Okay, thanks. Okay, very good. Next slide, please. So safety planning. So the 5 is about when you think that they are concerned there might be a risk of violence. And then 6 is specifically, okay, there is a risk of violence. How exactly are you going to help the survivor plan to stay safe? So sometimes staying home may not be the safest option. And in the context of COVID-19, well, that's a really difficult thing. So, but there might be a moment, there might be a time when they really should leave the home. How can they do this safely? So this set of tips is about helping the children, the adolescent or the adult survivors create a safety plan beforehand, thinking through what, in the event their situation of stress, of tension becomes much worse, escalates, and they might be in danger, how could they remain safe? So they need to plan this in advance. So this set describes how to do that. So they need to plan how to, if they decide to leave, how to prepare, when to leave, and what to do after they have left. And this set of tips also provides key issues to consider when preparing such a safety plan. So are they isolated at home with their perpetrator due to the lockdown? Are there any changes in their risk and protective factors? How can these be integrated in the safety plan? If medical attention is required, how will the survivor and a trusted adult be able to access health services? If they fall ill due to COVID-19, who else can the child or the adolescent turn to for help? Who can they call for help, and how will they do this? If they decide to leave, what documents and what items will they need and should they take with them? They need to think about and prepare that beforehand, and whether there are any other concerns that have not been discussed. So each of these issues is unpacked, and guidance is provided for how to address this. And there's also guidance provided for how to help children plan, children in this context, younger children. Yes, next slide, please. Then we're coming to the case management step of monitoring. Monitoring is a particular challenge, of course, when we are not able to see the child. But there's a lot we can do. Actually, as I mentioned before, through the telephone, through social media, WhatsApp, etc., Zoom. But also we can go to the physically to the house, but stay outside, ask them to come to the door. Guidance is provided around the frequency, the recommended frequency of virtual monitoring in for different types of situations. And then what to do, what would virtual monitoring involve? What exactly do you ask about? What exactly do you check? And how to do that? This is covered under virtual monitoring. Yes, next slide, please.
Okay.
Yes, then there are three, sorry, back 1 to 8. Yes.
Sorry.
Yes. So there are three sets of tips specifically around residential care centers. So this one, number 8, about guidance for how to help the children and the staff stay safe and healthy within the residential care institution, residential care center. So how to limit outside interactions, how to practice social distancing within the residential care center, how to practice infection control, the importance of listening to, reassuring, encouraging children and staff, and also of identifying symptoms early and ensuring care for the ill. So guidance is provided for each of these actions. Yes, next slide, please.
9.
So 9 is about, oh, sorry.
Right, sorry.
Yeah, sorry. 9 is about, so when children would leave a residential care center and go back home. And just to highlight what must be done to ensure that this transition is safe and that the child will remain safe and healthy within the family. The importance of engaging the child and the family throughout the process, documenting all preparations as well as the transition, and how to address infection control in this process. Thank you. Next slide, please.
Okay.
10. So number 10 is specifically about young people, typically at the age of 18, that because when they graduate out of a residential care center, and they might be, and on how to arrange independent living for them within the community. So what must be done, and what should be given care to make sure that, again, that transition is safe and that this young person is able to remain healthy, stable, and safe within their new home. And looking at the safety of transition and about engaging, the importance of engaging this young person throughout the process. Thank you. Yes, next slide. So the next step, so these tips have been developed in Malay and in English. They are available in PDF format, and they can be downloaded. They're disseminated through the platforms of the Malaysian Association of Social Work and of UNICEF, can be downloaded. They also all have a QR code, which they would really like the users to use to provide feedback. We would really like to know from social workers, other professionals, anyone who is using these tips, whether it was helpful, what other guidance or help they would or advice they would like, but also very specifically how it was helpful and maybe how it was not helpful. So we really would like that kind of feedback. It's very important. So I don't know, Sarah, and I think Hilma will probably also be on this call. So what other type of next steps or recommendations? I think Amy will also speak to that, Amy Bala. So I will hand over to them. Yes, thank you very much.
Okay.
Yeah.
Thank you very much, Francesca, for your presentation. Yeah. So so let me see. Yeah. Okay. Okay, Jana. Okay. Can Miss Jana, can you off your mic? Yeah, thank you. Sorry, yeah, okay. There's some noise. Sorry, yeah. Okay, for those who came a bit late, yeah, please mute your mic. Yeah. Okay, thank you. Yeah. Okay. Now, okay, our next speaker, okay, is Miss Ratna Devi. Let me share with you her credentials before I invite her to deliver her speech. Yeah. Hold on. Okay. Okay. So you can you see Miss Ratna Devi's beautiful picture and also her credential? Yeah. Okay, Miss Ratna Devi, Miss Ratna Devi binti Raja Kamal. Yeah, currently she is the care manager, okay, of the children's center. In locally we call it Pusat Aktiviti Kanak-Kanak of Yayasan Chow, yeah, which is based in NGO, work closely with at-risk children, youth, and families in Chow area of Kuala Lumpur. Yeah. As an organization, yeah, YCK or Yayasan Chow has cared for over 900 poor and marginalized children, including those from violent families and environments. So in her capacity at YCK as the case manager, as a center manager, Ratna started out as a center manager and has been with YCK for close to 7 years. Yeah. So her current role, okay, includes overseeing social work and homeschool, including two teams, yeah, two centers, two child and teen development centers and a safe home. Yeah. She's also the work also involves advancing and networking at the national level to protect the basic rights of marginalized children in Malaysia. Okay, Ratna has a degree, graduated with a degree in psychology in 2014, sorry. So she has developed, yeah, while working at YCK, she has developed interest in child welfare, yeah, because of her job scope. Yeah? So she needs to incorporate social work other than psychological knowledge, yeah. So she has since enrolled herself to do her master in social work at Universiti Utara, Malaysia, in Kuala Lumpur. Yeah, we have two campuses. One is in Sinto, another one in Kuala Lumpur. So we have a master's in social program at MKL. Yeah. So Ms. Ratna Devi is pursuing her master's of social work now. Yeah. So without further ado, I would like to pass this to Ms. Ratna to do her presentation.
Apa?
Okay. Yeah, Ratna.
Sudah dulu.
Ratna, let me see. Let me on your mic. Yeah. Okay.
Okay. Hi everyone. Can you hear me?
Sudah dulu.
Sorry, let me try to off the other one. Miss Yana Aris.
JKM, kalau kita bagi list banyak.
Sorry, Yana Aris, sorry, I had to off your mic. Okay. Okay. Sorry. Ratna, you can.
Okay. Hi everyone. Hope you all can hear me. First and foremost, thank you for giving me this opportunity to be a speaker on this platform. Today I'll be sharing more on our experience on the 10 tips that were shared to us in terms of case management. Maybe let me give you all a brief introduction about myself. My name is Ratna. I graduated in degree in psychology. In almost close to 7 years, I've been working with Yayasan Chow. Actually, I started off as the head of social work and the homeschooling program at Yayasan Chow. So coming from a background of psychology, suddenly heading the social work program was a bit scary and overwhelming. But with the guidance of the team and the interest to pursue child welfare more, I found this a good stepping stone for me. So let me give a brief introduction of Yayasan Chow. So we started about 2006. We work closely for at-risk children, youth and families in the Chow area. In total, we have 2 drop-in activity center, Pusat Aktiviti Kanak-Kanak and Kuala Lumpur Crash Pad is a teenage center. And we have a safe house. The safe home is mainly for high-risk children, maybe referrals from welfare department referral from UNHCR or whoever needs temporary guardianship. So currently in our safe home, at the start of the COVID-19, we have 6 boys, 2 girls, and total 8 of them from the ages of 1 to 11 years old. So we started off initially with the name of Nur Salam, but now we are known as Yayasan Chow. So actually our aim mainly at Yayasan Chow is provide a safe space and expose children to as many opportunities and potential to reach their full potential. So this provide food, age-appropriate facilities, and also a set of programs that is based on our 5 major pillars, which include educational, psychosocial, health, spirituality, and recreational. So in terms of the 10 tips that were shared with us, across the organization, we have a total of 6 social workers. Each center, we have a set of 2 social workers. So Pusat Activity, we have 2. Kuala Lumpur Crash Pad, we have 2 of them. And the Pusat Jagaan Baitul Amal in PJ, we have also 2 social workers. So in regards to the tips, maybe I will highlight those that are relevant to the context of YCK in terms of what we've been practicing in terms of management during this COVID-19. So first and foremost would be identifying children and families at risk. So at the start of COVID-19, initially, a lot of our clients, we serve at least about 100 children and teenagers across our organization. So most of them were daily wage earners. So many of them, when the start of MCO, they lost their jobs and couldn't go to work. So from the start of the MCO, we as a team, especially heading the social work team, we had quite often discussions on how we could reach out to our clients. So based on the first tips, which was identifying children and families, so we had to bring across all our database, access it through our Dropbox, and see how many of them actually in our system. So roughly we had about 100 families. So we usually share updates to our clients using whichever platforms we could have access to. So mainly were WhatsApp, but many of them couldn't even afford a smartphone. So we had to use SMS, we had to use personal calling, and those who have Facebook, we started video calling them using our Facebook platform as well. So any changes or any new rules regarding the SOPs and whatnot, we would update team, we would update the clients, because many of them, especially the non-Malaysian clients, were very afraid to come out of their houses. So the second one, which was assessing children and families at risk, we used to contact them using phone calls, online platforms such as, other than WhatsApp, I realized that Telegram was another very useful app actually that I could actually share with everyone here. That Telegram actually was very useful for us because we could reach out to more people, and the photos and videos doesn't store on your phone. So it's not heavy for both social workers and the clients as well. Third, providing psychosocial support. We realized that children and caregivers needed the support because based on what we engage with our clients, many of the children especially the young ones between the age of 7 to 12, found it very difficult being at home, because when they come to our center, they come as early as 8 o'clock in the morning. So morning we have a homeschooling program, and then followed by a educational program between 2 to 5. So the government school children come after their public school and come to our center. So the core times to do program was between 2 to 5. But since now everybody is at home, it was quite overwhelming for parents, because mainly all of them stay in high-risk areas such as Chow, Jinjiang, those kind of areas. And most of them live very small houses, small spaces. So imagine a family of 10 or 8 living in one space. So that's why we always checked on our children and teenagers, and social workers also have added those children who have internet access. We started viewing their WhatsApp status. That's when we knew that they needed us to reach out to them, and because on the status, some of them wrote like, it's very boring at home, parents are always fighting, those kind of challenges. So that's when we kind of stepped up in terms of reaching out to the clients. For the fourth one, which was managing stress and mental health, we realized that not only children were going through a difficult time, but also caregivers, and especially some of our staff who are working in the safe house. Since the start of the MCO, our activity centers in KLs were closed, but our safe house is open and it's on a 24-hour basis. So we lacked a lot of staff, especially overnight staff, since we have toddlers as well. So we started doing a schedule for staff whereby the KL staff who have not, or some of them who have not been to the safe house started going there and working on shift. So not only we had to engage the children's feelings, but also the staff, so to share what were the challenges, because I think there was a sense of uncertainty going on. How long would this pandemic be for? And some of the children were from our KL centers. So when they had to be moved to the safe house, they were found it a bit overwhelming, and they kept asking, when to the KL center, when can we start school? So it was very important. Like, I think each social worker sat down with the child and explained to them how long roughly would this take, and then started showing them articles or pictures. Sometimes articles might be too overwhelming for children, so it was more of like pictures and, you know, watching the news. So those kind of simple terms. I think with children and teenagers, sometimes you have to use a more simple layman terms rather than big words. Fifth would be staying safe when there is a risk of violence. So some of our clients, we know that the children are at a risk of having some kind of issues at home, because I think when we reached out to clients, we realized that many of them, especially parents, are so used to working a full day shift or maybe 10, 11-hour shifts. So the children mostly are at the activity centers. So when they are at home with the children, it was kind of a different situation for them, where it's a whole day with the children. And, you know, when you have so many of them at home, and then with financial struggles, so it was kind of overwhelming for them. So on our team, I think we almost had about 8 to 10 grocery distributions with clients. So every 2 weeks, we would all convene at our center in the KL centers and give out groceries. So for those who couldn't come to the center, again, because at the start of MCO, everybody was afraid to go out. So our social workers took our YCK van and had gone and given out groceries to their respective houses. And again, of course, as much as the virtual platform was useful, having face-to-face engagement does make a difference, because when we went and met some of the clients to give groceries, that's when they really shared, like, oh, we're struggling at home, the rent hasn't been paid, those kind of things. And some have the sense of, oh, we're a bit shy to actually share that we are having the struggle of paying the rent and the ability to contact the house owner and those kind of things. And some of them were close to eviction because of the being not able to pay for their rent. So we always cross-check with them, do you have enough groceries? So main things that we usually give out is dry groceries. So like rice, salt, eggs, those kind of things. In terms of virtual monitoring, I think social phone and social media has been very helpful. And for YCK, it's very hard to work in silo. We always have to work as a team. Since the start of MCO, about the second phase, we've already started online classes for our homeschooling program. So that was something new that the children had to adjust to, not only teachers, but also children as well. So teachers and social workers had a very close engagement between both of them. So sometimes certain children might share certain struggles to the teachers, which we would then discuss with the social workers on how we can reach out to them. So I think engagement with different teams in our organization has really been very helpful for us to help clients during this pandemic. The eighth one, which was care centers. So I think the tips when we checked with the social work team has been very helpful. This has been something that we were already practicing at the start of MCO, and now coming to almost the exit strategy, we found the tips very helpful. And upon checking with the social worker team, we realized that it does make a difference having these discussions and having constant cross-checking with each other really helped. So in terms of what we did in the safe house, some of the children that had left the KL center to the safe house, we explained to them actually that they had to come to the safe house, because the safe house is a single-story house. It's more like a temporary home. So things might have been different, the practices might have been different. So we had to make time to explain to the children why actually they had to be taken to a different environment. Secondly, it was important to stick to familiar routines, because before MCO, our children had a lot of outdoor activities, and every week we had regular programs that they could attend to, such as taekwondo, yoga, henna, those kind of things. So suddenly all that had to stop. But we wanted to practice the familiar routines for them, so that, you know, there has to be some kind of thing that they need to look forward to every day. So we had like homeschooling programs for the KL centers. And at the start of May and June, we already started having online classes for programs. So for the Children's Center, we had taekwondo, which is aired live on our Facebook page. So the children upload their attendance on that. So that's how also we monitor the children. And we have art class, henna, yoga, and taekwondo for the children's center. For the teenage center, we have photography class and taekwondo as well. So photography actually created a platform for them to express themselves, especially the teenagers, because a lot of them being stuck home, they ended up seeing their parents fighting because there was limited money, and then some of them had to take care of their younger siblings, and they had to multitask in terms that sometimes when there were classes, online classes, they couldn't use the phone because per family they might only had one phone, and some of them didn't have data as well. But we were quite thankful that during this MCO period, the government had given a 1 gig data free every day. So for those who couldn't have data, they shared with the teachers or social worker. So we would try to top up for them. So that was very helpful. And we realized that body movement was very important. That was part of the tips as well. So since we couldn't go out and do a lot of outdoor activities, social workers started downloading workout videos or like some fun fitness videos that could be played on the TV or laptop. And they were all excited and started playing, using those as a medium of expression as well. The fourth one was sharing of feelings. I think that was important. We realized that not only children were going through all these experiences, but even the caregivers were slowly starting to burn out, because even though in our safe house there were smaller number of children, but it's exhausting because they are at different ages, and even when you're teaching them, it was at a different pace. So we always cross-check with the staff as well. How are you feeling? Do you need any support? Or if you can't take it, maybe you can inform the supervisor. That's why it was important for the KL staff to come and support, center staff to come and support the safe house as well. Next would be safety preparedness. I think it was important to prepare those children, for example, if they were going home, what kind of steps that we could take. So we always have a surat, a letter of when the child is going back home. So since at the early of the MCO, we couldn't do home visits, but now we can slowly start doing home visits. So for those who need help of rental and whatnot, we can go and actually do a home visit now, but with limited staff. Not everybody goes, but maybe one social worker. Next would be COVID exposure. I think that has helped a lot in terms of actually getting the children and teenagers to understand what is COVID about. Maybe for the younger ones, we usually use pictures, we use those kind of platforms to explain to children. But for the teenagers, actually through their assignments, they were able to express like what could be done, what could be improved, or what kind of support they actually need as children going through this phase of COVID. So for the ninth one, which is reuniting children from residential care. So I think it was very important to inform parents as much as the children what is expected to go back home, because staying in our safe house and actually going back home is totally different. So the level of preparedness was very important before we reunite children with families. And for the 10th one, because we don't have very much at the moment, our children are between age 1 to 11, so there's not many going back home as of yet. But I think overall, moving forward, this tips has really helped YCK in terms of the context of case management that we do in reaching out to them. Because I think as social workers, you know that face-to-face engagement is very important, but we have to make do with whatever we have now, and you really need to think out of the box to reach out to your clients. As much as WhatsApp is there, video calls is there, sometimes constant follow-up is important. Maybe you have called the client on Monday, but you cannot wait till 2 weeks later to check up on them. Sometimes like 2-3 days, especially those you know that are of high risk. Maybe you know there's a sense of abuse, or maybe the husband while not working can be stressed out. So you need to identify that. And I think as a team, it has really brought us closer in terms of what needs to be done and what kind of things are important to the clients. Because for donors, sometimes they think like a certain thing is important for client, but social workers who do groundwork, you would understand better what is actually needed for clients. So I think overall, even though we are slowly at the recovery phase of going back, but since our KL centers are not fully open yet, but we keep on checking on clients, especially parents and caregivers, because slowly they have started to go back to work. So we are a bit concerned that the children are left alone, because usually when our centers is open, they send the children to the center. So now that they are home alone, so we always constantly engage with them to say at least have a relative or a neighbor to look out for the children and see how they can monitor the children, because we don't want many children to be like, I think those are some of the challenges that many of the parents and clients are having, that the centers are not open, so where do we send our children? Or example, if there is online classes, if a parent takes the phone to work, the children has nothing to do at home. So those are some of the concerns. Or when the child is at home, parents can do some engaging activities or to keep them occupied. But the moment parents go out to work, what do these children do? So to wrap up, I mean, my presentation, I think my feedback for these tips as a team, YCK found it very useful in terms of case management. But I think in reaching out to clients, especially those who are non-Malaysian, so access to maybe data, to handphones, those could be a challenge as well. So like what other platforms or mediums can be used for us to meet them or have face-to-face engagement with them? Thank you.
Okay, thank you, Ms. Ratna, Ms. Ratna Devi, for the very insightful sharing of the work of her of herself and also her social workers by CK during COVID-19. Yeah, so she has looked at how the tips prepared by Maestral International and UNICEF and MASW. Yeah, so okay, so so we are now going to the round of Q&A. Yeah, so we would like to open the floor for people to ask questions. Yeah, so I have one question from Dr. Dolly Paul Carlo. He's a social work lecturer from UNIMAS from Sarawak, and this is his question. Yeah, communication through phone, social media, Skype, Zoom, or virtual monitoring. Not all families have these devices or platforms. So issues such as connection to internet, location are not at all have devices. This is in particular in the context of Sabah Sarawak, yeah, okay, and even in most of the suburban in Malaysia. So Dr. Polly asked, whether the speakers, can you please give comments on this, yeah, the issues of connectivity, yeah. One is of course on the devices, and secondly on the connectivity, in particular those in the more suburban, rural, or even the interior area. Yeah. So so I leave to Ratna and also Francesca, who wants to take that question while we wait for other questions. Yeah. Yeah. Ratna, maybe you can.
Maybe I can share some of the in terms of context we have done work. So it was a challenge, like understand like those in the rural areas couldn't have access to internet. So some of our clients also face that same challenge. So I think I think the social worker, like I said, you have to think out of the box how you can connect, like for in terms of child kit. So sometimes even in the MCO time, we had to write letter maybe to the police station and said maybe we need to go and visit this family due to certain distress, or we find that something is wrong. So you need to take the extra effort to go and meet them physically to follow up, because if they don't have phone, there's absolutely no other way you can reach out to them. So I think the social worker as a team or whichever organization you're at need to think of new ways that how you can reach out to them, because having these tips are great, but sometimes when you do groundwork, I think it's very important for a social worker to think out of the box to how you can reach out to your clients, or maybe in a way suggestion to write to certain organizations or what, to see how you can create that access or platforms for those clients to get internet access or whatnot. I think that would be at a higher level for them to access those things.
Francesca, do you have any
Yes.
Yeah, any comments on that? Yeah.
Yeah, my camera doesn't work anymore, so I'll just only speak. So, but I have been. So yeah, no, this is a very important question indeed. Some people in some locations, and then also some people have are less accessible through social media. Now, generally, they do have a phone, so the just regular phone connection already is important, not to be disregarded. And then also, as I also mentioned, when you're not getting into contact, it is good to go to the house to ring on the doorbell, not to go inside because of the risk for transmission, but to stay at 1.5 meters outside and to ask them to come to the door and to have a chat on the doorstep so that you physically see the person. And then it is an opportunity to say, okay, now let's stay in touch. Can I call you? How can I reach you? In that kind of a way. But indeed, for some, the more social media possible. It's true. But we must find a way to still see them or get in touch through regular phone or physically by going to the door.
Teoh, can I share?
Yeah, okay. Amy, I'll come to you later, yeah, as a commentator.
Okay.
Okay, let me, yeah. Okay. 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 So so Francesca, just one question. Do you have, okay, because we imagine in Europe, okay, where access is, we presume access, there are more access there, okay, in terms of social media and all this. Do you have that problem also in Europe?
Oh, we have that problem here in Belgium too, during COVID-19. I mean, now very gradually things are opening up again, but for example, schools closed and children were, schooling was provided online, but it was not possible for all children to really do their schoolwork online and also with small children. So social workers connected to schools and teachers often actually went to people's homes to ring on the doorbell and to have a chat on the doorstep. Now that happened really quite regularly. I saw that even in my neighborhood here. So, and then also not everyone uses smartphones and social media very easily. And so that's even here, even when you would have good, it's not just about good connectivity, it's also about the ability to use these media. And so regular phone calls remain equally important. And then also in some, if it's possible to pass by and ring the bell and see how they are. That's also, it's always, even with social media, that's always, if it's possible, it's always a good thing.
Okay, thank you, Francesca. Okay, we have a second question coming from Nisham Kaur from Women's Center for Change. This is WCC from Penang, yeah? Welcome, Nisham. Okay, she has a question, okay? Let me read out the question. Okay, hello, how about the lack of child protectors in JKM, okay, the Department of Social Welfare? As in Penang, each district only have one child protection officer or child protector. Hence, when they are not around, it gets hard to remove a child at risk from the home, yeah? Especially a child experiences sexual assault by own family member. How can we address this issue? Yeah, we do understand the workload of child protectors, but they need manpower as well. Yeah, so this is a question raised by Nisham Kaur from WCC, Women's Center for Change from Penang. Thank you for the question. So I'll open this to Ratna and also Francesca. What do you do when, if the what they call the statutory social workers or child protection officers are not enough? So they are tied, they're hand tied, yeah? They are not able to respond to crisis, okay, the child protection issues in a very fast manner. What would you recommend? Yeah. Okay.
I think for us at UNICEF, we always, it's important to create that networking with the child protection officers from the welfare department. I think that working relationship is very important. So for any urgent cases where we understand the workload of the JKM officer itself, we usually contact them directly or actually have a case management file first. So what is the first? So we have our red zone, yellow zone, green zone. So cases like sexual assault and all, which is red zone cases, we take immediate action in terms of because we have an in-house manager who's also a counselor as well. So what is the first steps to do? Do we contact the police? Those kind of things, because eventually police, if it's a sexual assault case, they would also still refer back to the welfare department. So for us, I think that working relationship, certain things you have to take action first, not to overstep the role of a welfare JKM officer, but to create the networking so we can take the first important steps first to save a child, then following up on the next steps. I mean, this is what we practice at YCK, but of course we have easier access or other NGOs that also can support. If we need to remove a child, usually the question is, where do we place the child? Where can the child go? So at least we have that accessibility of our safe house or even our child center in KL itself. We have where those children can live in, but on a case-to-case basis. So we have that premise of, in case there's an emergency, the child needs to be removed. Usually if a child is removed, especially for sexual abuse cases, you can't simply place them in a home with other 100 children or whatnot. It's very case-to-case basis. How do you address the child, what the child went through? Sometimes they just want to be quiet for a while or for days. So at least having a safe space is important. So I think in KL, we have that accessibility of other homes or NGOs where they can go in case they need to be removed from their place. I mean, this is based on my experience I'm sharing.
Thank you, Ratna. Anything from Francesca before I get feedback from others as well from the floor? Yeah, Francesca.
Yes. No, I think as Ratna also said, what is really important is to always work in a network and to seek to establish and to develop and cultivate a network. I mean, in the best case, there are never enough statutory social workers to be solely responsible. We must always work within a network. Usually also, very often the first indications of concern, identification of children at risk, it really works very well when we are working in connection with other community-based organizations, neighborhood groups, neighborhoods where just neighbors have established a system of checking in on each other and helping each other. This all helps to be able to identify and then to share responsibilities when in responding. Of course, there are certain functions in case management that can only be fulfilled by statutory social workers, especially, as Ratna also mentioned, in cases of crisis or when a child has to be removed from the family. But a lot of the other support and checking in on each other, a lot can be done through various partners within a network. So as you will also see in the first tip, it also mentions this network, establishing contact with all other actors within your area of coverage to see how you can work together. And then it's very important to discuss together how you will practically work together, who will do what, and how you will record information, how you will pass on information, what information will be kept confidential, and how that will be done, etc. And what the responsibility of each actor is. But that must be well coordinated, well communicated and discussed. But the network is so important. Yeah.
Okay. I have a response from okay, let me see whether I got your name correct. REHAK, is it Reha or is a organization? Yeah. For the user, users Asus, can you on your mic and maybe you can give some of your comments and or your sharing?
Thank you, Mr. Teoh.
Yes.
City Howard here from
Yes. I was wondering what is Reha.
I'm sorry. Yeah, thank you. I was just going to share.
Can you introduce yourself and then so that people will know who you are?
No. I'm the City Howard from Reproductive Health Association, also a member of MASW. I just want to share this last year and this year we are doing a project with 150 children. So when COVID appeared. So what those tips that has been mentioned by Francesca and Ratna was really useful, and it's actually being applied as well. We try to apply that as well. I also recognize Dolly's sentiment just now, because the story that Ratna told is actually quite similar between urban and rural setting where we are working on. There are quite a lot of similar experience. So basically, if you can get in touch with the children earlier, that would be so useful. And if you can continuously getting in touch with them, you know. But if you notice, I put at the end of my a comment there is if the government can actually recognize us quickly as well, because our experience at this COVID, for example, there was like, you know, what you call it, at the second part of the PKP, I think, yeah, there's an issue whether the NGOs can go out and can, you know, and should it be just the welfare officers from the government sectors? I think this is where you miss out quite a lot, because the NGOs and the civil society could have done quite a lot of work and support, you know, on the ground. Because we know that the welfare department is not having enough staff, actually, you know. So if that is recognized very quickly, I think quite a lot of issues can be also settled. And as far as children at risk is concerned, you know, this is very difficult because, you know, when you have violence in the family, you know, it's very difficult that mother do not want to come out, and therefore the children will also not come out, you know. We did a quick survey for our children in the second week of the PKP, and many of them say they're concerned about the financial status, you know, and the children mentioned about there's a lot of tension and also, you know, quarreling between sibling and parents and all that. And even I give you an example, this morning we have our child decided that they cannot continue in our project because she has to move somewhere else, and we asked why, because the family just the parents were just divorced. You know, and we do not know how many more people are going to come out after this COVID going to have this kind of problem. And that's very worrying. You know, I was just the first case this morning. So I was thinking, you know, how many more is so tense that, you know, it can lead to this kind of situation. Yeah, that is all for the time being. Yeah, thank you.
Okay, thank you. Thank you, Prof. Siti Hawa. For those who may not be familiar with Siti Hawa, yeah, Associate Professor Siti Hawa is a lecturer at USM in Kubang, Korean. Yeah, so so she works a lot on violence, what they call the domestic violence cases. Yeah, so thank you for sharing. Yeah, and any comments from Ratna, and also feedback from Ratna and also Francesca?
I do agree with Prof. Siti Howard. I think it's important that we don't work in silo. I think a lot of NGOs do a lot of groundwork, who have access to a lot of communities, and also I think everybody at the end of the day wants to reach out to as many children and teenagers and whoever who needs help. So I think it's important to support each other as much, because certain things that social workers working in NGOs do not have the access of removing a child, for example, similar task that a child protection officer under the JKM has. So I think it's important to work together and support each other as much as we can.
Okay, thank you. Yeah,
yes. So also totally agree. I think the importance of working together with other actors and identifying other potential partners, people we can work with at ground level is just so important. So social work and protecting vulnerable children and vulnerable adults also is not an easy thing, and we really must all join hands to try to do this together.
Okay, thank you. Okay, at the moment we have 152 on the line, so it's a very encouraging number. We have two more questions. Yeah, one from both from Dr. Ling Hao Ki. But before that, may I know anyone from JKM here? Ada tak sesiapa dari JKM, pegawai JKM yang online in this webinar? Because the question posed by Dr. Ling is also related to JKM. So I wanted to know whether any JKM officers online now? Yeah, so that, you know, if you're around, then at least you can help to respond. Yeah, okay. Now let me just read out Dr. Ling Hao Ki's questions. Yeah, so she has two questions. One, do we know if there is an increase in number of calls in 15999? Okay, that's the first one. Yeah, and maybe this is for the question for the local participants. Yeah. Second, is there an SOP, okay, in JKM to give priority to child protection cases, suspected abuse cases? Okay, because she heard that many of them were deployed, yeah, to for food distribution, yeah, during the lockdown or in Malaysia RMCO, the MCO, yeah. So this is what Dr. Ling Hao Ki has written, yeah. Yeah, any response to that? Okay, one is that, is there any increase? I think maybe from WCC, I think WCC has shared, okay, in the media, yeah. I've read the news, yeah, and also from their Facebook that for WCC they reported an increase in calls, okay. I'm not. I think there's also some reports on Department of Social Welfare. So anybody who can respond to that, or who's willing to respond to that?
Hi, good afternoon.
Yeah.
Okay, you all can hear me. I'm Nisham here from Women Center for Change WCC.
Okay.
Okay, in relation with if there's an increased number of calls in 15999, actually we are not very sure, but we have actually how to say, engaged with them, and they are also actually recruited more registered counselors to volunteer in their hotline. So also our colleague have registered herself to be one of the volunteers, so that they will, if there's a call, they will engage them. So they actually, we can say probably they have a lot more calls coming in as well, because that's why they have to engage volunteers apart from their working staff as well. And yes, during the COVID-19, we can definitely say there's been a very high risk because as Women Center for Change, we also closely work with hospitals where they encounter for one-stop crisis center, where normally the domestic violence victims and also child at risk are admitted. And we have also seen a quite huge number of referrals during MCO period of time.
Okay, thank you. Okay, and anybody else that wants to share?
Can I share, Mr. Teoh?
Yes. Okay.
Regarding Dr. Ling Hao Ki's question about what's happening to them, we did engage the child protector during this time, because we have cases that come to the hospitals, yeah. And yes, I think they were overstretched, I think, during the PKP's time, because they have to do their child protection work as well as to support their department to do that, the distribution of aid. I was talking to them, and I found that this is very, very difficult actually, because they also have to look after what you call it, the quarantine area. The child protector also have to do the service of becoming one of the staff at the quarantine area. So I think this is overstretching them really. So I do hope that, we can give this feedback to their department so that maybe things can improve, because a lot of people are, also, blaming them for not being effective. But at the same time, during this PKP time that I have engaged with them, I know that many of them are actually very, very overstretched. Thank you.
Thank you. Thank you, Prof. Okay. There are some questions keep on coming. Yeah. So let me read out. Yeah. This is from Amalina from UNICEF, yeah? So, hi everybody. Could anyone share an experience of using the code? Yeah? So, if you have seen the code, yeah, or the tips, okay, to identify if a child is at risk, okay, how you go about it, yeah? So, that's for you to think about, and we would like to hear from you, yeah? Okay, how you use the code to identify if a child is at risk, yeah? And then from Dr. Yusmaya Hani, do you have a list of NGO database to know where we can do placement for vulnerable children or women? Yeah, if yes, how can the public access this? Okay, and then from Tulasi, yeah, I just trying to read out as many questions as possible. Then we'll see how we can tackle one by one. Yeah, we found that this is from Tulasi. We found that refugee children have inconsistent access to the state hotline 15999. Is there a way to narrow this gap of access? Yeah. Okay. So also from Tulasi, how can we support state or statutory child protectors who are inuited, okay, with child protection cases? And what can civil society and NGOs do to support them in responding to children at risk? Yeah, I think some of the responses maybe just now from Francesca and also from Ratna and also from from Prof. Siti Hawa Ali already responded to that. Okay, but okay, if you have any response, yeah, Francesca.
Yes, I do. About the code, I think that's misunderstanding. So the code, what I mentioned about code, is not about identifying if a child is at risk. This is a code. So this is quite a few hotline services use this. When someone calls a hotline, people call hotlines for multiple reasons, sometimes to talk, sometimes to share information, to ask questions, to ask advice. But sometimes people also call a hotline in crisis, when they are really at risk, when there is a situation possibly of danger. And so what some hotlines have developed is a collaboration with another service, to be able to organize an intervention to help the child or the adult escape the dangerous situation. If there is a person in the home, if the perpetrator is really violent and it is, the situation is escalating badly, the child, the adult, they can call the hotline, and if they know, if either they say, look, this he is hitting me, I don't know, or she is hit, I don't know, whatever, I'm just saying something, I'm being hit, I'm in danger. So this is a real crisis call. Then, or sometimes, because the perpetrator can be very close by, they cannot say that they are in danger. So then sometimes, so what some hotlines do, and this is in collaboration also with social workers, they agree beforehand on a sentence, a word, a code that they can use to indicate that they are in huge danger and that they need help. For example, they say, they call the number, I am imagining here, number 223, and they say, hello, can I order a pizza pepperoni? Of course, I mean, the hotline operator knows immediately that's, no one calls a number 223 to order a pizza. So this might, so it could be, so in for example, in this situation, the hotline might have said, look, ordering a pizza pepperoni on our number, this means this is your indication that you are in danger. We will immediately send you a grab. So you just run out the house, the grab, and then the operator can say, good, we're sending you a grab. The grab will be at your door in 5 minutes. Make sure you just run out of the house in 5 minutes. So that's what the code is about. The code is an agreement between the hotline service, social workers, to be able to send in an emergency escape route for the survivor. Is that clear? Does that help?
Yes.
Everything has turned quiet.
Sorry, I accidentally mute myself. Yeah, sorry. Okay, so very interesting, Francesca, for sharing that using the code. Okay, what I'm interested to know is that whether within our country we what you call practice or use that code. Maybe Ratna, do you have any experience that you have a code with the children coming to your organization that that they can use so that they can indicate certain emergency?
Yeah, I think for YCK, we always empower our children, and the moment they step into our doors, that this is a safe space, and we keep on repeating that it's a safe space, because I think they fear that if they share anything with us, we will go and inform the parents. And I think sometimes they're afraid that perpetrators might be from the home itself. So usually our safe word is like, whatever you share here, we'll call the child personally to a room, like maybe 2 social workers or 1 manager and 1 social worker, and we address the situation with the child. So whatever, it's with consent, even though of course they're below 18, you still need to inform your parents and talk to your parents, but I think it's important to empathize with the child as well, because most of the children that come to our centers have seen a lot, despite them being young as 7, but they've seen a lot of things, and growing up in high risk areas like Chow, they've seen more things that an adult would have seen before. So I think empathizing with them and actually understanding what is it they want. Maybe sometimes they just want a place to share, or just a platform to share what they're, even as small as like the parents fighting, for them might be like something severe to them. But I think it's important as social workers how you address the problem. Is it by going and straight away inform, oh, your child is feeling stressed that you're fighting at home? Because we've also had children cutting their hand because the parents are fighting a lot at home, but the parents don't even know that the child is cutting her hand at home. So how you move forward from there, it's very important, because that might break or make a child. So I think code words for us is always enforcing that empowerment on the child as well, regardless if you're a child or a teenager, that when you come to our doors, it is a safe space. And that's very important. And I think having the child protection policy, that the respect should be two ways, not only the children and teenagers respect staff, but also vice versa. So I think our code word is more to, I think of course in different contexts, different organizations practice different things. We don't have a specific code, but I think that empowerment really made a difference. I mean, and you can see the progress over the years. I think there are different challenges across the years. So like nowadays, there's a lot of bullying, cyberbullying, a lot of children having access to phones and going to cyber cafes. So I think the trends have changed, but I think you always have to be alert as a social worker. What is the current trend? What is it they're going through now? So every child, even though they look normal when they step into your doors, but I think working with them every day, you kind of know if something is off. So I think every few months, we always do a refresher on our child protection policy, always empowering the children that, you know, you have a right. If you're not comfortable with something, even as simple as holding them on their shoulder, but it's important to tell them if you're not comfortable, you should let us know.
Okay, thank you, Ratna. Okay, I'm very mindful of time. Now it's 4:30. So I'm going to read the last question, yeah, before I invite our two commentators to make their views, yeah. So this is also from Tulasi, yeah. From experience, we found that children at risk approaching SCAN, this is a SCAN team at hospital, are forced to lodge police reports before medical support is available to them, contrary to the one-stop crisis center and SCAN policy. What can we do to address this situation? Okay, this is about when the child, yeah, being sent to hospitals, yeah, the children at risk, you know, has to forced to lodge a police report, yeah, before medical support is available. Okay, which is contrary, yeah. I'm very aware that this is contrary to the OSCC and also SCAN policy. So any Ratna, so would you like to, do you have any experience with that?
I think for us, usually when we have any 10 cases, we always work together with the welfare department, social workers. So far, we didn't have really any challenges in that. Or if we have referrals from other organizations, usually they will settle the SCAN part of it and bring them to YCK in terms more of placement. So when they come to YCK, it's more of case management. So we have cases of children who have been in detention, who have maybe referral from UNHCR. So we cover more of the case management part. Then we work closely with other organizations to see how we can help the child. But in terms of that, so far for us specifically, we don't really have that case, because usually we have to report to the government social workers to see how they can go about it. Okay, thank you. So yeah,
can I just do a contribution?
Sure.
I was sharing the OSCC.
I was just about to want to invite you.
Yeah, because I work on OSCC. I think Tulasi's comment is sadly is quite true. You know, I mean, even though we have trained people many years and all that, you know, still there are people who are not comfortable if they don't see a police report on their table, you know. We have to keep on doing education on this matter. But of course, in this case, in this kind of situation, the person that accompany the children, especially if they are NGOs or civil society representative, should insist on, you know, the treatment first, you know. Yeah, because a lot of time, I think if the medical personnel or the healthcare providers choose not to provide that, then you actually have to say the rights, the rights of the child, and also to actually announce to them about the, the policy, the idea of integration in that policy. Basically a person must get the treatment, and in that process, if the person is willing to do a police report, then yes, of course, they have to do it. And of course, there are statutory situations, which then the healthcare providers or the social workers who accompany them, would have to do the reporting themselves, So all this is actually, I know there are some good practices, there are people who are very good at these practices, but there are still people who, who are not comfortable if they don't see police report before they can do this treatment. Yeah, thank you.
Yeah, I think what Prof. Siti Awal mentioned is that we have to keep on pushing, yeah, and trying to, do it professionally, yeah. So can I invite our first commentator, Dr. Azlin Hilma Hilaluddin, from who is the head of department from the School of Applied Psychology, Social Work and Policy, UUM, to give her comments, yeah, on what has discussed this afternoon. Yeah, Dr. Azlin, yeah, let me on your mic. Okay.
Okay, can you hear me?
Yeah, we can hear you. Yeah.
Okay, thank you, Teoh, and thank you very much to the two speakers and all our participants who have posed very interesting questions and also responses, that we get to hear from what in the field are experiencing with clients in real cases. What I got from the two speakers is that I think both of them have shared very important and real situations that social workers need to deal with during the MCO and or quarantine time. And the main issue that they raise is
Yeah, Doctor, are you okay? Hello.
hear me
Yeah, just now the sound was cut off just now.
already?
Yeah.
This is one of an example of
Azlin, sorry, your line is not clear. Maybe you can off your video so that we can hear you more clearly. Is that okay? Yeah, Azlin, can you off your video so that we can hear you more clearly? Yeah, maybe because of the data, or what they call the connection. Hello, Dr. Azlin, are you there?
Hello? Yeah.
Yeah, we can hear. Yeah. Okay.
I have a connection here, my part perhaps. Can you hear me?
Yes, correct. Very clearly. Go ahead.
Yeah?
Much better. Yeah.
Much better. Okay. Sorry for the disruption. Okay. Both of the speakers shared very important and real situations. In one overseas and one here in Malaysia. What I got from their presentation is that child protection cases, clients cases, they go on. They do not stop, even though the world comes to a temporary halt. Well, the world appears to come to a temporary halt during the COVID-19 epidemic. In fact, there is a potential that cases have increased as more people are staying indoors longer, and there might be more cases that go unreported. And the issue that I would personally like this MCO or this epidemic affected social work practices worldwide. Francesca, for example, shared with us how her organization has worked with UNICEF to come up with the tips for social workers in working with children during the MCO. I've had some time to, just briefly go through the tips as displayed on MASW webpage, and I found that they are particularly effective in ensuring that social work case management process still addressed and achieved and not compromised. And I like the tips that she shared just now. That one of the tips to ensure that social workers remain in contact with clients is that they go and have home visits, ask clients to step outside of their home and then to report their progress, and also the use of virtual monitoring, virtual support. I guess the thing to use to social workers need to be familiar with is the use of that.
Sorry, Dr. Azlin, we are losing you.
Yes.
Hello.
Hello. Hello, Teoh.
Yeah. Sorry, Dr.
Okay.
Yeah, your line is not clear.
Not clear, huh?
Yeah. Okay. Now it's much better. Just now was very trippy.
Okay. I am so sorry. Okay. I was also using technology, but now technology is showing that sometimes it is a challenge. Like Dr. Dolly just now, he highlighted, in Sabah and Sarawak. It's not just in Sabah and Sarawak. Sometimes in rural areas here in the Malaysia also, we are experiencing connection problems, especially like now we as educators, social work educators, we are conducting online classes. We are also experiencing challenges with students, a connection when they got disconnected, or even we as the lecturers got disconnected. But anyhow, regarding connection, I was pleased to hear Ratna's suggestion with her tips is that we have to make do what we have, okay, and to think outside the box. What can we do? These are we acknowledge that these are challenges, but we still need to reach out to students or reach out to clients. So we just we need to find what works with even with clients or students. And she also addressed one thing just now is the challenge to stick with familiar routines. Children, they like routines. Okay. And then what they did at Yayasan Chow is I would like to comment on their effort to maintain as much as possible familiar routines that the children were doing before. Now have, for example, having karate lessons online, just making sure that they maintain with the routines that they had before. And I think that is one of a good tips for social workers working with children, is to try to maintain as much as possible, making children feel less anxious, make them feel familiar with things that they have been doing before. So that's my comment for the time being, Teoh.
Okay. Okay. Thank you, Dr. Azlin, for your comments. Yeah. So I would like to invite now Mrs. Amy Bala. Okay. Mrs. Amy Bala is the current Vice President of MASW. Yeah. So you can see that both of Dr. Azlin and Mrs. Amy Bala info, yeah, or their CV, which I share now. So Mrs. Amy, please, okay, proceed with your deliberation.
Thank you, Teoh. Can you hear me?
Yeah, we can hear you. Thank you.
Okay, thank you. Thank you very much to Francesca as well as to Ratna. Also to the answers provided by Dr. Siti. to some of the questions raised. I shall not go back to the tips because I think we've already discussed enough. I like to focus a bit on the questions asked by the participants. Like that, Dolly raised the issue of how to reach out to children at risk when there is no connectivity, and at the same time, children do not have the access. They don't have gadgets. They don't have any handphones at home. Based on my experience during early COVID, when it first started and the lockdown started, this issue actually came up quite a bit. Well, there was also a question whether the hotline received calls. Yes, the hotlines actually were very, very active. And from JKM, I heard that, but 70% of the calls focused on request for food rations. Only about 30% was on call for help from children. So, but first, as we all know, during the lockdown, only JKM could go out to distribute the food rations. So that was a big challenge for children at home as they could not really reach out. However, the SOP changed and NGOs were allowed. So when NGOs were allowed, I worked with some of these NGOs, again, virtually on remote. And many of them who went on the ground, they did more than just distribute food. They spoke to families, they asked questions, they also went into the homes, and they managed to actually reach out to many of these families in the interior communities who did not have any form of gadget. So they found out not only about women, not only about children, but also women who needed help. So they could, in their own way, respond to help the children at risk, as well as refer back to the welfare department. There were also rural areas, children were doing schooling online, and those children who had no gadgets, like Sabah, Sarawak, Kedah, Kelantan, there were quite a number of them. What happened was the teachers from these rural areas went to the children's homes. And again, they were able to detect, and they referred back to the NGOs, and the NGOs brought those statistics back. That was for the first question. When it comes to child protectors, yes, as we all know, JKM is stretched. And it's not only JKM who can actually rescue a child. If there is urgent need, the police also can do that. So you can report to the police, and the police can go and rescue the child with you. They are gazetted to also rescue. Currently, JKM was also gazetted assistant child protection officers from NGO sector. One of their job is also to help to rescue, but I think they're not able to do because they're still waiting for official gazette. They're gazetted, but they do not have the cards to them. So that is one of the issues there. And as Siti said, Dr. Siti said, actually the children who go to scan, the scan team actually should treat the child immediately. And it's a case by case. Some of the hospitals, they do not insist on a police report. In some cases, they do. So yes, we need to do a lot of advocacy training to ensure that children who are already vulnerable, who are already violated, who are already suffering, do get treatment straight away. So that's really important. And we really need to sensitize, which means not only social workers, NGOs, we need to do more advocacy so that not only the social workers realize their rights, but children also get their rights. I think that's very important. That's it. I'm cognizant of the time as well. There's another 10 minutes.
Okay. So Amy, you okay?
Yeah.
Okay, thanks. Yeah, thanks, Amy.
Sorry.
Any more? Okay.
Just one more. In my interaction with the social workers and the NGO sector, when we shared these tips, actually many of them found the tips from 7 to 10 really useful, especially 7 and 8, because they taught them the various ways of actually reaching out. So I was also able to reach out to the social workers using email, because email was another channel which was very useful for us to send the tips, send suggestions, and there were also a lot of SOPs available, not only local but also globally. So many of these tips we downloaded, MASW downloaded, and we shared to many of the social workers in the NGO sector.
Okay. Thank you, Amy. Okay. Before I ask the two speakers to to make a concluding remark. There's one question, yeah. I think should be the last question for today. Perhaps there'll be more, but okay, there's one question here from Yazir, yeah, from Yazir Raza. How to identify a girl who is raped or involved in sexual abuse, okay, or sexual abuse by her family, and how to give the first step to help the girl. Okay, this is the situation where a girl who lives only with her grandfather and she was raped, I think presumably by the grandfather. How the girl wants to be to refer the case. Does she know how to make a report, because she is too young to handle this problem or feel scared if the grandfather or the perpetrator knows of her action? Yeah. So for Ratna and also Francesca, this is a question from Yazir. Yeah. That would you want to respond to that? This is a sexual offences, yeah, sexual offences, yeah.
Okay, before I was respond, maybe theoretically I can maybe explain that situation. Yeah, the issue with reporting has always been a challenge, especially in child abuse and in particular sexual abuse cases. There are many times that victims do not know that they can get help, that the abuse can, and abuse particularly happen at home behind closed doors. Nobody knows about it. Okay, and it takes someone very close to the child. Perhaps that person is a person that the child trusts the most, so they do the first disclosure to that person. So perhaps one of the thing that the trusted person, the adult who hears that story, is to help the child to make the report. Okay, because many times children don't know where to go to. So we as adult, if we know that kind of cases, we need to help them. We need to empower them, to do the report. And many times victims are very scared. What if the perpetrator knows about what happened to them? But we also need to empower them that you have the power to stop this. This needs to stop, and we need to report this. Thank you.
Thank you, Azlin. Yeah, Ratna, maybe from your experience.
Yeah, I agree with Dr. Azlin. I think it's important, like the first person who knows that disclosure, to tread lightly from that, because you want the child to be safe. Because you don't want to end up making a report and the steps you've taken is wrong, the child might end up with the perpetrator again. So I think it's important to build that rapport with the child, depending how old is the child, and it's important to get the child to safety first. And also when you go to the police station, of course they'll ask if the grandparent is being reported, who can the child go and stay with. Those kind of steps also, it's important. These kind of cases, you want it to go all the way. You don't want to start something and then ends up being the child goes back to the family, then they will lose trust in ever making a report again or having that disclosure again. So I think this kind of cases needs to be handled really well. And like when you make a report, the child needs to feel safe. How you ask the questions to the child also is important. And when you go and for the medical checkup, the child needs to be followed by somebody they trust as well. You don't want to leave the child with people they're not familiar with. And also I think that's why teaching children from a young age about their body parts, what is safe touch, I think that has really helped in terms of our organization. Yayasan Chow, we try to ensure that every year we have a safe touch program, and it has made a lot of difference to the point we actually have a box where you can put in like anything that happened, your home or anything like that, they will put it in the box, and you can see with the children the difference of how they react, how they talk. You can see the changes in the children. So I think having the rapport with the child is very important, not to always assume what you know best is for the child, but also understanding from the child perspective. I think because nowadays children are exposed to so many things at such a young age, we don't believe that the child would have seen this or heard this or experienced this. So I think it's important to actually acknowledge when a child tells you something, to take it seriously.
Okay, wonderful. Okay, Francesca, is there anything you want to add, or should I?
No,
yeah.
I think what Ratna said was, that's really perfect. That's very true, very Right. Also, just to highlight that in the tips number 6 around safety planning, there's also 2 links to further information, the GBV guidelines, the pocket guide, and then also another link to from the hotline, www.thehotline.org, that provides a lot of advice also and guidance. And there in those tips also there's also just also general recommendations of how to respond, but it's very true. Take it seriously. And yeah, what I was saying, totally on the mark. Thank you.
Okay, thank you. So before we proceed to another our last session, okay, I would like to invite both Ratna and also Francesca. Okay, I will give you each 2 minutes to wrap up. Your take home. Okay, what is the take home message you want the participants to have today? Yeah. So can I start with Ratna then before I proceed to Francesca?
Yes, thank you, Mr. Teoh. I think based on whatever everyone has shared and the questions that were shared were very good, very important questions. I think everybody should, whoever has attended the session or try to advocate that these tips are actually very important. Of course, some needs to be fine-tuned according to your context of organization, because of course there's 10 tips and there's a lot of info in it, but you need to take back what is relevant to your organization and how you can actually reach out to the children. Because some work, some don't work. Like some people, for example, have access to internet, some don't have. So how do you go about it? Will you just give up? Because we always assume that everybody nowadays have access to smartphones or internet. But I think to always be mindful that your clients come from different backgrounds, different status, different affordability. So to always keep that in mind. And when you speak to clients, it's important to speak in a term that they understand. So I think the tips are very useful. You should sit down as a team in your organization and discuss, go through it together as a team, even though if you're not heading to office, but at least to discuss virtually on to see how you can move forward with this, because COVID isn't really over. So you still have the chance. For example, our centers are not really open, but once they start to open, how do we mitigate this? How do we address these concerns? Because sometimes we don't know where the children will be going, what they're going through. So what is our action plan when the centers start opening? So I think more people should start reading these tips, and to improve this, of course, everybody should give feedback. I mean, reading it is one thing, but I think it's important to give feedback to see how we can improve or what could be added in the tips as well. Thank you.
Okay, thank you, Ratna. Okay, Francesca, your
Yes,
words. Yeah.
just to add on to what Ratna already said, so also from the feedback, so I think also would really encourage participants to explore and broaden their network of partners, of groups, of organizations, of beyond the statutory social workers, but to broaden the network of to identify who they can work with, who they can collaborate with on the ground level, at the community level, to be able to respond appropriately and adequately to the needs of vulnerable children and their families. So I want to thank you all very much for the participation. I learned a lot, so I think I want to add to the tips maybe more attention to how to address the situation of children, people who who have less access to internet. It's mentioned there, but maybe it needs to be highlighted more. And the importance of also passing by when it's possible to have a doorstep visit. So, but yeah, so thank you very much. I really look forward to seeing the feedback on the tips using the QR codes. It'll be very important. Thank you very much. Thank you for inviting me to this.
Okay, thank you, Francesca. Okay, well, just as we about to come to the end, yeah, just okay, so I will invite Dr. Sam, yeah, our president, to give his word of appreciation. But okay, after his speech, don't go away yet, yeah, because I want everybody to switch on their camera video so that we can record, yeah, all your faces, yeah, all your lovely faces today. Yeah, this is our the first time that we do a webinar. So I would like to invite, yeah, Dr. Muhammad Suhaimi, President of MASW, to give words of appreciation. Dr. Suhaimi.
Right. Assalamualaikum. Hello. Ni hao. Namaste. Thank you, everyone. I'm very grateful on behalf of Malaysian Association of Social Workers, MASW. I would love to congratulate all the co-organizers, UNICEF Malaysia, Sarah, and School of Applied Psychology, Social Work and Policy, Universiti Utara Malaysia, for successfully organize this webinar. All right, special thanks to our excellent speakers, Mrs. Francesca. Thank you so much from Maestral International, and Miss Ratna Dewi. Thank you from Yayasan Chow KL. And then thank you to our lovely commentators, yeah, Dr. Azlin Hilma, the head department of School of Applied Psychology and Social Work and Policy of UUM, and our lovely Madam Miss Amy Bala, Vice President of MSIDU, my right hand person, yeah. And then thank you to our great moderator, Mr. Teoh, who is senior lecturers at the UUM, and also our MSW Excos. Okay, I think this webinar today is very fruitful. It highlight and discuss about all the 10 tips for social workers protecting the children during the COVID-19. Okay, that's thank you to the producer by Maestral International and UNICEF, as well as with MSW, yeah. So our role there is to actually as a resources and also edited the material to ensure that relevant to the local context in bilingual, yeah, English and Malay versions. Also, we also share the material on the MSW Facebook. This is very excited. We receive 1.7 people reach for the tips. And also for today, we have like 155 participants. For me, that's great, excellent. Yeah. I hope all of today benefit in discussing all the effective social work approaches and also all the issues that are being raised by the participants. We discuss how to use the tips for the social worker and also for the children during the MCO. And also now we are in the recovery movement control order. So I think it's very important for social worker to be in front. We have to highlight our jobs and also make action. So we have to go for change as well. Okay. And last but not least, I think it's exactly 5 o'clock. I would like to appreciate and thank you all the participants again for this wonderful session. And thank you. Hope to see everyone again. Not just virtual and also physical, not just in Malaysia, maybe in Belgium. All right. Thank you.
Okay, thank you, Dr. Sam. Okay, so okay, there are two more things, before we close the session. Okay, one is that can I ask everybody to who can switch on their videos, do switch on their video so we can capture the screen, and then after that I will post a poll, to get your feedback for the webinar today. Yeah, okay. Can I get everybody just to to post your to switch on your video, so that we can capture, we can capture all the
Mr. Teoh,
yes,
we have to smile.
Sorry, I have to smile. Yeah,
Yeah.
everybody has to smile. Yeah. Okay, if you're outside, if you're by the roadside, please wear this. Yeah, but if you're not, you're at your office, is okay. Yeah. Okay, so can everybody on your video? Yeah, I'm going to capture the screen. Yeah, now. Yeah. Okay, if you want to take photos, the problem with this is that you never see yourself. Okay, let me capture the first video. Okay, hold on. Okay, I try to. Okay, thank you so much. Wait. Let me. I want to do the print screen, but it's a bit cumbersome. So let me use my handphone, to capture. Yeah. Okay, hold on. I'll go to the second screen. Okay. Okay. Sorry. Yeah. Just give some time because it's slow now. Because yeah. Okay. Thank you. Now let me take the photo here. Yeah. Okay. Sorry. We I didn't, okay, in webinar sometimes we didn't have time to introduce ourselves, yeah, so you have to excuse us. Okay, so that's why please remember to fill in the Google form, yeah, which I already posted on our chat, so that you know we in for future events we know how to contact you, yeah. Okay. 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 The photos keep on popping, so I'm not sure, yeah. So I hope everybody are in. Okay. Okay. So officially, I think we have more than, at one point we have. Okay, let me just send the Google. Okay, let me just do send you the hold on, the polling first, yeah. Okay. So can you just, okay, at the moment we have 121, yeah. Just now we have I think at the peak we have 158, yeah. Okay. So okay, please, okay, fill the form, and I will post the what call the link of the Google form, yeah, shortly, yeah. Yeah. Also, remember, yeah, check out our MASW website so that you can look at the tips. Yeah, you can download, okay, and give us feedback. Yeah, the feedback is for not only for MASW but it's also for UNICEF and also for Francesca. Yeah, so that we can keep on improving on the tips. Yeah. For social workers working with children, not just only in Malaysia. I think that is also applicable to many other parts of the world. Yeah, so our colleagues in other countries as well. Okay.
Have you posted the link? Because
Okay.
I can't see it.
Just about to. Yeah. Okay, just posted the link. Yeah. So for those who came much later, yeah, do fill up the form so that we know how to contact you. Yeah, we just want to know, where you're from and how do we get in touch with you. Yeah. So once again, I would like to thank Francesca. Yeah, I'd like to thank Ratna, and also we like on behalf of MASW and also UUM. Yeah. I'm wearing two hats here. I'd like to thank UNICEF, yeah, UNICEF Malaysia, Sarah, leading Lenin and the group, yeah, for all the support, yeah, given to MASW in particular in having these tips, yeah, for social workers. I hope that these tips will be beneficial to all of you, yeah. So thank you so much, everybody. Yeah. So once you have, do the poll and then fill out the form. Okay. Okay. So if you want to know and if you want to get in touch with us, yeah, you can always browse our website. Okay. Thank you all. Yeah, thank you all. So after this, okay, once you're done, okay, Dr. Dolly, thanks so much. Thank you so much. Yeah. Hope to see you again. Yeah. Okay. Thank you, Lini. Okay, thank you so much, everybody. Yeah, thank you so much.
Selepas Train 4 gerabak mula beroperasi pada awal tahun depan. Ketua Pegawai Eksekutif Rapid Railsnya Berhad Abdul Hadi.
Somebody is sharing the news with us. Thank you. Okay. Okay, my student ya, pelajar-pelajar saya ya dalam etika dan undang-undang ya, sila stay back ya. Saya akan bagi QR code untuk ambil kedatangan ya.
Menunggu juga dikurangkan kepada 6.5 minit kepada 5 minit.
Jadi akan pada kita starting pada Mac 21 dan seterusnya sehingga Disember 2021. Dengan ini kita dapat menambah.
Thanks, Teoh.
Okay, thank you so much. Thanks Amy.
Thank you.
Okay, Teoh, thank you.
Thank you Dr. Sam ya. Thank you.
Thank you, bye.
Okay, so thank you everybody ya. Sorry tak ada jamuan, sorry ya. tak ada juadah ya. No tea, no cakes ya.
Harga tiket kami tentukan oleh kerajaan, sebenarnya kita tak boleh pandai-pandai ya.
Dalam perkembangan lain, ketika ini jumlah penumpang harian monorail KL menurun daripada 36,000 kepada 19,000. Ia berikutan sekatan pergerakan yang dikuatkuasakan akibat penularan wabak COVID.
Okay, so yang staff, okay, isi bagi nama dengan nombor pekerja ya. Okay.
Perkara itu disahkan oleh Jabatan Bomba.
Yeah, so we only have
mengurusi catatan dalam Facebook. Dianggarkan beratus-ratus pelombong dikhawatiri tertimbus dalam kejadian awal pagi tadi. Seorang anggota polis tempatan bagaimanapun memaklumkan usaha mencari dan menyelamat ditangguh.
Thank you so much kerja. I have to save all the information.
Australia sedang mempertimbang dengan serius cadangan menyediakan perlindungan kepada penduduk Hong Kong. Perdana Menterinya Scott Morrison berkata, situasi yang berlaku di hub kewangan Asia itu amat membimbangkan. Menurut beliau, kabinetnya akan membincangkan cadangan itu dalam masa terdekat. Namun,
thank you, Dr. Azlin. Thank you. Ya, thank you so much ya.
Makan-makan minggu depan ya.
Ada.
Meeting.
Yes. Ya.
Sekian berita disunting oleh Rohizah Muhammad Zain dari Pusat Berita RTM. Assalamualaikum dan salam sejahtera.
Okay. Okay, so sorry ya, sekejap tunggu sekejap ya. Anybody yang bukan dalam kelas tak apa. If you want to ask question, you boleh ask ya. You can ask question ya. Okay, because I tunggu sekejap saya nak on QR code. Okay. Okay, so para pelajar macam mana? Okey tak? Macam mana anda tengok perbincangan tadi? Ada feedback?
Okey, sir.
Ya, okey ya.
Sedikit.
Boleh faham tak?
Boleh.
Ya.
Boleh ikut juga, sir.
Okey.